Our next and final presenter, Paul Scott from AIDS Services of Austin.
Good evening. Tonight I'm asking you for something that no one else has. I'm asking you for zero. Zero new HIV infections in Austin. AIDS Services of Austin is opening a state-of-the-art medical clinic, creating an innovative, sustainable, and life-affirming care model that puts us on that path to zero HIV infections. How? Two strategies: treatment as prevention and PrEP, a medication that is 99% effective in preventing HIV. We have the tools to end the HIV epidemic. Yet, since 2010, new HIV infections in our community have increased by nearly 32%. 1 in 6 Austinites who are HIV positive don't even know that they are, making it more likely that they would transmit the virus, become ill, and yes, could even die. If you're HIV positive, timely access to health care means better health outcomes. The ideal standard is for a newly diagnosed person to be linked to their initial medical appointment within 3 days. In Austin, that can take nearly 45 days, resulting in over 500 people that either drop out of care or never access care in the first place. Our solution? By operating our own medical clinic and providing centralized services and access to life-saving medications, ASA will link HIV-affected people within 3 days into comprehensive, patient-centered medical care, fully incorporated into our existing set of services. We are asking for funding to support a director of clinical services so that we can start serving patients in July. We will then be on the path to zero HIV infections and will ensure that HIV-positive patients are not only surviving, but they are thriving. HIV prevention is a lot less costly than HIV care. Every HIV infection we prevent in Austin saves between $230,000 and $325,000. If your $100,000 investment prevents 10 HIV cases in this community, that is nearly $2 million in savings. If we were to prevent the 300 estimated cases this year, that is nearly $70 million in healthcare savings for our community. Getting to zero in Austin means we can get to zero everywhere. Our medical clinic is sustainable and scalable through a prescription drug reimbursement program, providing earned revenue that by year 3 will cover our costs, allow for expansion, and ensure that no one is turned away for inability to pay. But our clinic is more than just about the numbers. It is about Brenda. Brenda came through our doors 5 years after her diagnosis. She was very ill, out of care, homeless, and struggling to meet her basic needs. She thought HIV was a death sentence. ASA helped her regain control of her health and helped her address her barriers to care. So tonight, I am asking you to invest in Brenda, to invest in ASA in the community, to invest in zero. Thank you.